Hi, my name is Dr. Tejaswini Trivedi, and today we're going to talk a little bit about rosacea. So, what is rosacea? Rosacea is a chronic, inflammatory, and recurrent type of a skin condition where the patient presents with a redness, which is erythema in the medical field. And there is this other type of rosacea, which is papulopustular in type, which where the patient it can look like acne. So if you want to differentiate between rosacea and acne, you can watch my previous video. Next we have so how do you treat rosacea? So first one is azelaic acid, through which you can treat rosacea. There's this funny story where if a patient has tinea versicolor, which is a condition, these patients, when they went out in the sun, they got tanned everywhere else, but not where they had these hypopigmented, hypochromic patches on their skin. And scientists found out that there is this organism known as Malassezia furfur that produced some substance because of which they didn't get tanned in those areas. There were these hypopigmented patches and hypochromic patches on their skin. So that substance that was created through Malassezia furfur was azelaic acid. So azelaic acid is organic because of that. It is a friendly substance which is a friendly dicarboxylic acid, and it can be therefore used in case of pregnancy patients. If you are pregnant, you can use azelaic acid, no problem. And it is also found because of through rye, you can find it through wheat, you can find it through barley also, you can make it now. So azelaic acid is wonderful like that. It is also useful in case of patients of rosacea where they have persistent erythema, meaning that redness doesn't go away and has been there for a while. So for those patients, azelaic acid is the first line treatment for that redness, erythema, persistent erythema. So that's why azelaic acid is wonderful like that. It can be used for hyper pigmented post-inflammatory hyperpigmentation, meaning there was an episode of inflammation post that episode. After that episode, they had hyperpigmentation. So that can be treated through azelaic acid. Next, it can be used for acne patients. P. acnes organism can be treated through azelaic acid. Next, it can be used for rosacea, as we all know. How does it help in case of rosacea? Is because there are these toll-like receptors on the surface of the skin. So these toll-like receptors are sitting on the surface and they are interacting with the environment. Now, something, if it comes into contact with them, let's say too much sun exposure happened, and these toll-like receptors got activated. Now, once they do get activated, what are they going to do? They're going to cause an inflammation cascade inside the cell. So they were on the surface, something happened, which is too much sun, for example, triggered the toll-like receptors, and inside the cell, the whole inflammatory cascade started. So that's why if you use azelaic acid, you can prevent inflammation cascade. Let's say the rosacea happened because of demodex mites, or it happened because of too much sun exposure. So in these inflammatory conditions, azelaic acid will help you in the treatment of rosacea. This is how it helps. This is the mechanism of action. Next, we have tranexamic acid. So now tranexamic acid is also used as a treatment for rosacea, but there's this funny story. Let's say you go to the ICU or you go to an emergency department. There's a patient comes to you which has been bleeding too much, and in case of that profuse bleeding, we use tranexamic acid, and it can prevent the cause of death in these patients. So that tranexamic acid, which is a wonderful drug in preventing the cause of death in people, is also used in case of rosacea because of its anti-inflammatory properties. So tranexamic acid therefore is wonderful in case of the treatment of rosacea. Next, we have adapalene. So adapalene is wonderful in case of rosacea because of its four properties. First is anti-inflammatory properties. It helps in case of erythema, that is redness. It has antimicrobial properties, and fourth, it helps in the case of demodex mites. So that way, adapalene is wonderful. Next, we have, let's say you have rosacea. So how is your skincare going to be different from a normal person's skincare? There is this sandwich technique where a person is supposed to wait 15 to 30 minutes, even 20 minutes in some cases, and they are just after washing their face, they're supposed to pat it dry, then wait for 15 to 30 minutes before they apply anything on their skin. Then after they waited, they should start with a skincare moisturizer. After they use the moisturizer, then they can use the skincare ingredient wala thing, and then again use a moisturizer. So what happened here? First, dry skin. Second, after waiting 15 to 30 minutes, second they used a moisturizer, a good moisturizer. Then they used the skincare ingredients, and fourth they did was again a moisturizer. So this is why it is known as a sandwich technique. Compared to a normal person, where it's called a 1 minute rule. Our dermatology professor said this 1 minute rule, where a person washes their face and within just under a minute they're supposed to apply the skincare on the skin for better penetration. If they do it within 1 minute, normal people, then their skincare is going to penetrate much deeper inside the skin. So that is for the normal patients. For rosacea, we have the sandwich technique. Next, there is this acaricidal method for the treatment of rosacea. So let's say, for example, you have rosacea and it has happened because of demodex mites. So you would want to kill them, obviously. And how do you do that? Is by acaricidal methods. So there are three examples we have. First is benzyl benzoate, ivermectin, and metronidazole. Now, metronidazole, in case of rosacea, let's say your rosacea is not a mild form of rosacea. It has gone much further, and it has caused dilation of blood vessels, where meaning telengectasia. So it was there, it has been here, and now the blood vessels on the surface of your skin have dilated. So permanently, that is known as telengectasia. So in that case of rosacea, that type of rosacea, you can't use metronidazole because it is not beneficial there. But if you have just erythema, if your rosacea is mild, if your rosacea is in the preliminary stage, then you can use metronidazole, and it is beneficial because it has anti-inflammatory properties. It helps with the erythema, which is the redness. So metronidazole can be used there. But if you do compare ivermectin with metronidazole, ivermectin is much more superior than metronidazole. Why is that? Is because ivermectin has a superior efficacy, first of all. Secondly, it is helpful with the case of recurrence rates. It kills the demodex mites. And third is, it is helpful for continuous treatment effectiveness. So that was done. Now, after acaricidal treatments, we are going to talk about the last thing, that is niacinamide. Niacinamide is beneficial in case of rosacea because of its anti-inflammatory properties, and it also helps with the redness. So that was all about the treatment of rosacea. Thank you. Goodbye.